Coming together is a beginning, keeping together is progress, working together is success. Good morning, everyone present here. I, Dr. Farhan Asfaruq, Assistant Professor, Department of English, School of Social Sciences and Humanities, privileged to extend my hearty welcome to Home Sterling Global University's 2 days international conference on recent advancement in pharmaceutical sciences, health and applied sciences, blended mode organized by OSGU's School of Pharmaceutical Sciences, School of Health Sciences, and School of Applied Sciences in collaboration with Bingham University, Nigeria. Our willingness to wait reveals the value we place on the object we are waiting for. So, without making you wait anymore, let us proceed towards a technical session chaired by Dr. Sahil Kumar, DPSRU, New Delhi, and co chaired by Dr. Nafisul Hassan, OSGU, Hisar. So, I request Dr. Nafisul Hassan, Sahil sir will be there after some time with us. I request Dr. Nafisul Hassan to chair the session and be there on the stage. So, please. Thank you, sir. So please be seated. Thank you so much, sir. Now, moving towards the technical session, we have our first participant, first delegate, that is Garima, Miss Garima, and her title of paper is Molecular Talking and Dynamic Simulation of PLKT inhibition with the help of QSAR modeling. So she is going to present offline. Now, I request Ms. Garima to be there on the dais.
Greetings everyone. I am Garima, research scholar in chemistry from Om Sterling Global University, Hisar. Today I am here to present my presentation on the topic molecular talking and dynamic simulation of PLK1 inhibitor with the help of QSAR model. First of all, I am thankful to all the organizers and chairperson of this session for providing me such an opportunity. Here is the introductions. In 21st century, protein kinase has become an important drug target for cancer-based drug discoveries. In this series, FDA has approved in the year 2022 approximate 72 protein kinase inhibitors. PLK1, that is polo-like kinases, belongs to the serine threonine kinase families of this kinase family containing 5 members in its groups. PLK1 is highly expressed as most dominating member of this family due to its overexpression in different cellular functions like cells differentiation, cell apoptosis, and various biological functions as well. Due to involvement of uh, Due to involvement of PLK1 in all these biological functions and enzymatic activities, PLK1 became a significant feature in cancer-based drug discoveries. So it becomes an idealistic target for developing anti-cancer drugs. So medicinal chemists are involved in growth of PLK1 inhibitors. Some examples of PLK1 inhibitors are NMS, P937, Volastrip, etc. Now, What is QSAR? QSAR is basically to find a relationship. It is a tool or technique to find a relations between structure and activity of the compound. It to find detailed insights of the structure features. QSAR models for PLK1 inhibitors have been developed. Among them, from the model, the most active compound was selected for further studies. Now, what are the materials and method which I have chosen? First one is dataset. Uh, for studying QSAR, a series of compounds having similar structural features is selected. And then structures of these compounds were done with the help of Marvin's sketch software. And then descriptors are calculated. Descriptor. Then what are the descriptors? These are uh, these are the numerical forms. That is, the structure information is converted into numerical values, and so the descriptors were calculated. They contains each and every details of the structures, and then some extra unnecessary data were removed from the descriptors. Then the data set is splitting into then dataset is splitting into training and test set. With the help of where it may be 70% or 30% ratio. Then by randomization is done with the help of different permutations and combinations method. These are the steps involved in QSAR model development. First is drawing and optimization of structures, then calculation of descriptors, and with the help of random splitting into training and prediction set. Then development of these QSAR model with three descriptors were obtained, and then model is validated. What are the different model validations? Model validation parameters. There are different statistical external internal validation parameter as described by OECD, that is Organization for Economic Cooperation and Development. The developed model should satisfy some particular parameters, that is regression parameters, q square values, which have some fixed values. If our model satisfies these values, then our model is good. Then molecular docking. What is molecular docking? It is just like enzyme catalysis process, lock and key model of an enzyme. Similar way, here protein ligand is fit into the binding pocket of proteins. This is a way to check that our compound is interacted with protein or not. So it is a comprehensive tool to investigate the binding interactions between receptor and ligand. There are different softwares like Autodock software tool, iGemDock software, which are used to perform the docking protocol. Here, in this study, I have used the iGemDock software to perform the docking protocols. For docking, first of all, the structure of protein is obtained from the RCSB site, and then there are different poses obtained from the docking, and the best one is taken for further studies. Results and discussions in QSAR. The following results and statistical parameter obtained from the QSAR studies. Here, a particular equation is obtained from the study of QSARs. And here in this study, three descriptors were obtained. Two were correlated positively, and one is correlated negatively. Uh, that means that the value of descriptors defines the models, and very reliable and statistical model was developed. The value of R square regression parameter is 0.8213. It means that about 82% of compounds satisfy these models. R3 descriptors explains the predictivity and reliability of the models. These are the plots which I obtained from the study. We can see from the graph that all the compounds should lie in a particular range, and this will satisfy the QSAR models. Now molecular docking. With the help of molecular docking, we find that the L28, which is the most potent compound, forms hydrogen bond with the key residue arginine 136 of the proteins, and similarly L28 forms hydrophobic interactions with the key residue PHE 183, and hydrogen of amide group form H bonding with the residue leucine 59. The nitrogen atom of the ring form H bond with the key residue hinge region residue cysteine 133, and we find that it forms similar interactions as that of protein with internal ligands. These are the diagrams which I obtained from the docking studies. This is the first one is 3D structures. We can see from the structures that the ligand is fit into the binding pocket of proteins. And this is the 2D diagrams. From there we see that arginine 136 is bonding with hydrogen bonding, and various other interactions are shown in the docking results. Now molecular dynamics. To analyze the stability of the protein ligand complex, MD simulation was carried out. This can be done with the help of Desmond software of Schrodinger's, and this with the help of dynamics within each nanosecond simulation was done, and we found that it forms similar interactions as we obtained from the docking. These are the results which obtained from the docking. We can see that protein and ligand bind about 100 almost all the time with the ligands. Same diagram, 2D diagram, which obtained from the dynamics, and these are the PL contents as shown below. And at the last, not but the least, there is a conclusion. We obtained that the QSAR model is statistically reliable and robust model, and easily understandable QSAR model will be developed. And during development of QSAR model, all the guidelines of OECD were followed. And DOC indicates that strong hydrogen bonding interactions between protein and ligand. MD simulation study also verifies the docking results. So we can say that this study helped in designing of new anti-cancer drug with the use of PLK1 inhibitors. There are various other inhibitors also which we can study. Thank you and have a nice day. If you have any query, you may ask.
Anyone from audience?
Thank you.
Thank you so much, Garima. Now, next participant we have is Miss Tamanna, and she is also going to present through offline mode. And her topic is a review on metal contamination in soft drinks and its impact on human health. Miss Tamanna?
नेक्स्ट कैंडिडेट को बुलाओ। इसके बाद नेक्स्ट ऑनलाइन जुड़ा हुआ है। ऑनलाइन हाँ, एक बार ये तमन्ना वाला बाद में करेंगे। ऑनलाइन जुड़े हुए हैं।
All right, we have another participant connected with us through online mode, and she is Miss Neelam Yadav, and her topic is a review on design and discovery of pharmacologically active 2-PV-lidone. Neelam, could you hear me? Are
Yes,
you
ma'am.
Okay, you can proceed with your presentation.
Ma'am, my screen is visible or not?
Yes.
Okay. Good morning to all.
Your
I'm
PPT
Neelam.
is still not visible.
Excuse me, ma'am.
Your PPT is still not visible.
Not visible. I'm sharing my screen, ma'am.
Ask her to share her screen.
You share your screen.
Ma'am, I'm sharing.
Okay. It is still not visible.
Ma'am, screen is shared. I don't know why it is not visible. Ma'am, now visible or not?
Sorry, Neelam, still not visible.
देखो आपके पास है आपका प्रेजेंटेशन
स्टार्ट कर दीजिए।
Just Neelam.
Please wait for a while, Neelam.
Yes, ma'am. Ma'am, is visible?
Okay, we are sharing by ourselves. Okay, you can just proceed with your presentation, right?
Okay, ma'am.
It's there on the screen. You can begin. Thank you.
Okay, ma'am. Good afternoon to all. I'm Neelam, a research scholar from Chaudhry Charan Singh Haryana Agricultural University. Today I'm here to present a oral presentation on review on design and discovery of pharmacological active 2-pyridine scaffolds. First of all, contents includes introductions about pyridines. Second is the pyridines as a drugs and pyridines used as a natural products and the biological importance of 2 pyridines such as antimicrobial activity, anti-cancer activity, anti-inflammatory activity, phytotoxic activity, diuretogenic activity, etc. And the last one is the conclusion. First of all, we describe about the introductions. Nitrogen-containing heterocyclics 2-pyridines are a family of natural products that are extremely rich in diversity and biological activity, and they possess various pharmacological activity. Due to diverse biological activity and their abundance in natural products, pyridines have always attracted much attention of scientific community and synthetic organic chemistry. These pyridines are not only medicinally active but also used as a synthons for the synthesis of other heterocycles. Next one is the pyridines is used as a drugs. Natural products featuring the 2 pyridines core are active ingredients in many medicines such as chitosan, fredricamycin, camptothecin. Fredricamycin is used in treatment of addictions where fredricamycin was isolated from the natural species fungi and used for the cancer treatment. Same camptothecin is also used as a cancer treatment. Next is the bioactive natural products. Pyridine core have been found a key role in biological active natural products. Ricinin was the first pyridine alkaloids isolated from the castor bean plant, which having insecticidal activity. After that, a large number of natural derived fungal metabolites with 2 pyridine core structures have been isolated. Naturally derived pyridines such as pyridoxine, cordypyridines, leporins, etc., extracted from the fungal species and the other metabolites or other natural sources. They possess biological activity such as kinase inhibition, anti-malarial, antibacterial activity. Saccharomycins derived from the fungal species Septoria Pisterium having anti-Leishmanial activity. 3 acylated 4-hydroxy 2-pyridines such as militarinone and TMC69 6H also derived from the natural products having neurotogenic activity and anti-cancer activity respectively. Next one is the biological importance. Pyridines exhibits diverse biological activity such as anti-malarial, anti-inflammatory, antiviral, antifungal, antibacterial, anti-cancer and neurotogenic etc. First of all, now we discuss about the biological importance of 2 pyridines. In view of the growing significance of these compounds as the biological agents, a detailed account of synthesis of various pyridines have been presented here. 2 pyridines core are widely used as a antifungal and active antibacterial agents. Cichiloflox containing 2 pyridine structures used as a antifungal agents. Ahadi group described the synthesis of 2 pyridines, 3 carboxylic acid derivatives, and evaluated the synthesized compounds for their antimicrobial activity against various microbes. 3 formyl chromines with the meldrum acid and primary amines in the presence of diammonium hydrogen phosphates provides 2 pyridines 3 carboxylic acid, and the last step of this reaction involves the decarboxylation affords 5 substituted 2 pyridines, and the synthesized compounds were evaluated against various microbes such as staphylococcus aureus and the fungi Candida albicans, and we found these two compounds are highly active against Staphylococcus aureus. Trichodine A is the natural products isolated from the Trichoderma species, which having antifungal activity. Inspired from the structural feature of the Trichodine A, Kamauchi group synthesized fused two pyridones. Reactions between phenylestronitride and the melanonitriles affords 4-hydroxy 2 pyridones, and the 4-hydroxy 2 pyridones reacts with the aliphatic aldehydes to form fused pyranopyridones or bicyclic or tricyclic 2 pyridones, and these synthesized compounds were evaluated against the fungal species such as Candida albicans and Aspergillus, and the bicyclic compounds was found to be active against the Candida albicans. Next is the anti-cancer activity. Fredricamycin and camptothecins containing two pyridones having anti-tumoral activity. Pyridons are diverse in biological activity, including anti-malarial, anti-inflammatory, antifungal, etc. Fusaricides and leporins are the two pyridons which possess antibacterial and antiviral activity. Makhemer group developed a methods for the synthesis of pyranopyridons using a condensation reactions between 4-hydroxy 2 pyridones with benzylidine melanolitrides in the presence of a base such as piperidines. But the biological activity of these synthesized compounds were not evaluated. After that, a McDowell group developed a different methodology for the synthesis of these pyranopyridons. They describe a multi-component reactions between pyridones and various aromatic aldehydes with melanonitriles in the presence of triethyl amine that provides the pyranopyridones. And the synthesized compounds were tested against various cancer cell lines such as HeLa cell lines. And they observed that the compound that contain three bromo substituents on the aromatic rings are strongly against the HeLa cell lines. Next is the anti-inflammatory activity. Two pyridones and the pyridones are reported as the cyclooxygenase enzyme inhibitor and the anti-inflammatory activity. Goncalves group synthesized two pyridone derivatives using a reactions between beta-enamine diketones and melanonitriles in the presence of a base that affords 3-cyano 5 substituted 2 pyridones, and these compounds shows anti-inflammatory activities. Next is the phytotoxic activity. Daminer group described a different methodology for the synthesis of bispiridyls and pyranopyridones and evaluated these synthesized compounds for their phytotoxic activity. Dehydro, sorry, hydrolysis of a diacid to provide say pyrene derivatives. These pyrene derivatives treated with the ammonia afforded say 4-hydroxy 2 pyridone, and the 4-hydroxy 2 pyridones reacts with the aliphatic aldehydes to give pyranopyridones through the electrocyclization reactions, where the aromatic aldehydes reacts with 4-hydroxy 2 pyridones give bispiridyl, and the bispiridyls derivatives and these pyranopyridones were tested against sorghum bicolor, and this compound was found to be highly active against the sorghum bicolor. Next activity is the neuritogenic activity. Militarinone and the ferinosone are the natural products that enhance the neurite outgrowth and used for the treatment of Alzheimer and Parkinson disease. After that, Schroeder group described the synthesis of 4-hydroxy 2 pyridones, and these synthesized compounds were tested against the MAP4K4 kinase. In the first step, 4-hydroxy 2 pyridones reacts with the bromine in the presence of HBr, bromination. First step of the reaction involves the bromination, dibromination, 3,5-dibromo, and the next step involves the methylation, O-methylation. Second step of the reactions involve the lithiation at the third positions, and followed by the aldehyde reaction with the aldehyde, and the third step of the reaction involve the boronic coupling reactions, Suzuki boronic coupling reaction in the presence of palladium catalyst that affords 5 arylated 2 pyridone, and the last step of the reactions involve the deprotections of the 2 pyridones and provides 3 acylated 5 arylated 4 hydroxy 2 pyridone, and the 3 acylated 4 hydroxy 2 pyridones was active for the neuritogenic activity. Next is the last is the conclusions. 4-hydroxy 2-pyridones are extremely rich in the biological activity, and their occurrence in the natural products and also used for the drug designing and discoveries. In view of the growing significance of these compounds, and we have I have presented a detailed account of synthesis of various pyridones, and also presented the biological activity of these compounds. Researchers all over the world are continually exploring the biological activity and synthesis of natural product inspired synthesis of 2-pyridones for the betterment of the life. Thank you. Any query?
Any query? Thank you so much, Neelam. Now we have Dr. Sahil Kumar, DPSRU, New Delhi, who is going to chair the session along with Dr. Nafisul Hassan, OSGU, Hisar. So before we proceed towards the technical session to another participant, we have, let me introduce you to the eminent personality of Dr. Sahil Kumar. Dr. Sahil Kumar is working as assistant professor at Department of Pharmaceutical Chemistry in Delhi Institute of Pharmaceutical Sciences and Research, Delhi Pharmaceutical Sciences and Research University, New Delhi. He has completed a B Pharma and M Pharma from Guru Jambeshwar University of Science and Technology, Hisar, and PhD in Pharmaceutical Sciences from IK Gujral, Punjab Technical University, Jalandhar, and has more than 11 years of teaching and research experience. He has worked as Senior Research Fellow in DRDO, New Delhi Project. He is gold medalist in pharmaceutical chemistry at post-graduation level. He has published more than 50 research papers and review articles in many reputed national and international journals. He has presented papers in many national and international conferences. He has filed one Indian patent. He has contributed a book on computer aided drug design for B Pharmacy 8th semester as per new PCI scheme and syllabus. He has been recipient of award of DST Inspired Fellowship and 8 Best Paper Awards at national and international conferences. He is active researcher in the field of pharmaceutical chemistry, computer-aided drug design, polymer chemistry and technology, and chemical drug delivery. His thrust area of research include design, synthesis, characterization, and biological evaluation of novel medical molecules and polymeric prodrug design and synthesis for targeted drug delivery. Thank you so much, sir, for coming here. We are very much delighted that you are here to chair today's technical session. Now, advancing towards our technical session, we have another participant with us, and she is Ms. Sarita Sangwan. Sarita Sangwan is a research scholar from OSGU, and she will be presenting on an overview of progress in synthesis of pharmaceutically significant cyano-substituted 2-pyridones. Sarita, could you hear me? Are you connected with us?
Yes, ma'am, I can hear you. Am I
All right,
audible, ma'am?
yes, you are. You can proceed with your presentation.
Thank you so much, ma'am. Just a second, ma'am.
Okay. Some background noise is there from your side, Sarita.
Yes, ma'am, I'm correcting.
Okay.
Is the screen visible, ma'am?
Yes, it is.
Okay, so good afternoon, everyone. I am I am Sarita Sangwan, research scholar at CCS Haryana Agricultural University. I am here to present my presentation on the topic of an overview of progress in synthesis of pharmaceutically significant cyno-substituted 2-pyridones. So the contents being an introduction to pyridones scaffolds, biological significance of cyanopyridones, some pharmaceutically significant cyanopyridones, and an overview of works of synthesis on cyanopyridones with emphasis on their biological activities, antimicrobial activity, anti-inflammatory activity, anti-cancer activity, cardiotonic activity, and lastly the conclusion slides. First of all, is the introduction. The two pyridones and their derivatives are part of natural products and many synthetic compounds. It is extremely diverse and rich nitrogen heterocycle, which is part of many natural products. Chemtothecin, huperazine A, as you can see, these are the nitrogen heterocycles, which part of extremely rich nitrogen heterocycles, which are used in Chinese traditional medicine for treatment of many diseases from ancient times. Out of these two pyridone scaffolds, cyno-substituted two pyridones, which are also part of natural products. For example, ricinin, which is an alkaloid isolated from castor beans, which is an insecticidal. Similarly, 3 and 5 cyano-2 pyridones are part of compounds which display a range of biological activities which are suitable for pharmaceutical purposes. So, in the present article, I have highlighted the major works on synthesis and biological significance of this compound class. Majorly, the biological significance of cyanopyridones can be classified into five subheadings, which is antibacterial activity, antifungal activity, anti-inflammatory activity, cardiotonic activity, and anti-cancer activity. So, to have a look into the biological significance of these compounds, the mainly the activities are classified into three types, which is related to some enzymatic inhibition at the molecular level. So, first of all, is the anti-cancer activity, which is attributed to serine or threonine kinase inhibition action of these cyanopyridones. Also, they can also be related to PIM1 kinase inhibition, which is directly involved in the cancerous development of any tissue. Cardiotonic activity, which is attributed to the phosphodiesterase enzyme 3 inhibition at the molecular level. Similarly, anti-inflammatory activity, which is based upon cyclooxygenase enzyme inhibition, can also be attributed to the activities of cyanopyridones. Now, pharmaceutically significant cyanopyridones. Now, phosphodiesterase enzyme 3, which is a promising target for drug design in case of cardiac disorders. So, small molecule PD3 inhibitors are the potential compounds which can directly be used as drugs for the treatment of congestive heart failure disease. In the line of development of these small molecules, two pyridone based molecules have been recognized as the effective drugs in the treatment of congestive heart failure, which are embrinone and milrinone. These are the cyno derivatives of pyridone. Now, works of synthesis on cyanopyridones. I have classified these works of synthesis under four subheadings by inclusion of their activities. First of all is the antimicrobial activity. Darvish et al. Synthesized a class of two pyridone derivatives which are containing a sulfur-moil moiety. These are synthesized with the help of a multi-component reaction between aldehydes, melononitrile, and cyanoestamide derivatives. The reaction takes place by Novengel condensation, firstly between benzaldehyde and melononitrile to give the rylidine intermediate, followed by its Michael addition with the cyanoestamide derivative. The reaction yielded 50 to 60% yield of the substituted products. The synthesized compounds were evaluated for their antibacterial activity against both gram-positive and gram-negative strains of bacteria and some fungal strains also. And the synthesized compounds were found to display notable antimicrobial activity. The compound displayed at the bottom displays the most significant antimicrobial activity, which is having the 4-chloro substituent at its phenyl ring. Synthesis of two pyridone molecules with the starting of acyclic compounds is a very significant area in organic synthesis. In the same line, Atta et al. Reported the synthesis of 3,5-dicyano-substituted two pyridones, starting from aromatic aldehyde melononitrile, and cyanoacetohydrazide. The reaction took place in the same manner. The aldehyde and melononitrile fuse in the first step to form the rylidine melononitrile by the Novengel condensation, followed by its reaction with the cyanoacetohydrazide, resulting into highly substituted 2-pyridone cyanoderivatives. The compounds were found to be moderately active against the tested strains of bacteria and fungi. Similarly, in the same line, Pandit et al. Synthesized carboxamide and cyanofunctionalized pyridone derivatives. He used the Hans one-port pyridone synthesis process by multi-component reaction between cyanoestomide, substituted aldehydes, and acetoacetanilide in presence of base, which was piperidine, and in ethanol solvent. These compounds were tested against 4 bacterial strains, and highest antibacterial activity was found against Staphylococcus aureus with diameter of zone of inhibition being 4.25 millimeter. Similarly, with E. coli, it displayed 3.75 diameter of zone of inhibition, and the most active compound or highly active pyridone found in the series is displayed at the bottom. Now the anti-inflammatory activity. Now inflammation occurs whenever there is foreign invasion of germs or maybe a tissue injury. The inflammation process is directly linked to cyclooxygenase enzyme activity. Now, as we all know, PCM or paracetamol is a drug of utility in case of inflammation, and also it is also an antipyretic drug. On basis of its utility, Fayed et al. Designed a pyridone scaffold using paracetamol as basis. Through rational drug designing, they substituted the acetyl group of paracetamol with heterocyclic substituents. All the compounds were tested for their anti-inflammatory as well as uh, microbial uh, anti-inflammatory as well as antimicrobial influence both in vitro and in vivo. They used the red po edema model, and they found the compounds to be highly effective against the inflammation. The percent inhibition caused by the most active compound was 65.13%. The compound was having the hydroxy group or para-hydroxy group at the bottom. The 2-pyridone derivatives were synthesized by reaction of
Very Sarita, could you?
2-cyano and yes,
Yes,
ma'am.
I'm sorry to interrupt, but the participants have to wind up their papers within 7 to 8 minutes. All right.
Okay, ma'am, I'll do it faster. Okay.
Thank you so much.
Compounds having both anti-inflammatory and anti-cancer properties are of great interest. So, in this line, Helal et al. Carried out the synthesis, biological evaluation, and molecular modeling of 2-pyridone derivatives, which displayed both anti-cancer and anti-inflammatory activity. The IC50 values for this anti-inflammatory potential was found to be 2.41 and 1.34 micrometer, which is a very significant data in case of anti-cancer and anti-inflammatory activity. Nayadi et al. Similarly reported the microwave-assisted synthesis of cyano-substituted 2-pyridones, followed by their glycosylation with penta-acetyl glucose. These glycosides were very effective anti-proliferative drugs as tested against the cancerous cell lines, human promyelotic leukemia cells. Next is the one-port synthesis of 2-pyridones by Buduma et al. They developed a synthetic strategy for series of 2-pyridones by two-step procedure. Firstly, they synthesized the 4H pyrenes, uh, which were reconstructed into pyridone scaffolds by using iodine in presence of reflux medium, and the activity was tested against MTT assay. The compounds were specifically active as displayed by IC50 values of 8 to 15 micrometer for the observed cell lines. Next is the cardiotonic activity, hypertension being the main reasons for cardiovascular disease. As we discussed previously, phosphodiesterase enzyme 3 is directly involved in cardiovascular disorders. So, small molecule inhibitors directly target these enzymes. In this line of work, Hernandez et al. Synthesized 3-cyano-2-pyridones by rearrangement of pyrone compounds, which were synthesized from a condensation of aldehyde, melononitrile, and ethyl acetoacetate, which were oxidized into pyridone compounds of utmost significance. These compounds were found to be highly cardiotonically active, with the potency being 95 to 100%. Now it's the conclusion and the way forward. Now, as from the discussion, we can see that 2-pyridones are an extremely rich class of heterocyclic compounds in terms of biological activity. Therefore, these compounds must be explored for the betterment of human society. And 3-cyano-2-pyridones is also a rich class of 2-pyridone heterocycles, which must be evaluated for utilizing their full potential against biological disorders, and so we can directly contribute to the betterment of human society. Thank you so much.
Okay, we have some questions. Okay.
I have one question. What is the mechanism of Neuville condensation reaction?
Sir, am I audible, sir?
Yes, you are audible. Am I audible to you?
Okay. Yes, sir.
Did you hear my
Sir,
question?
yes, sir. In Neuville condensation, we have active methylene compounds which are attacked by bases to generate the carbon ions, which then attack on carbonyl units to generate the alkylidene or arylidene intermediates.
Okay, last question from you. What is the probable mechanism of action, the compounds you propose for the cardiotonic activity?
What is the mechanism
Yeah.
for the synthesis, sir?
You in beginning you told about some drugs like amrinone, and later you proposed some synthetic schemes which showed for the cardiotonic activity. Could you propose the mechanism of action, probable mechanism of action of these compounds?
In case in activity, how they inhibit the PD3, or the activity, how is activity related? I didn't understand the
I,
context, sir.
okay, fine. Can you just last answer me the mechanism of action of amrinone only?
Sir, they mainly act as enzyme inhibitors. PD3 phosphodiesterase 3 is involved into causing the cardiovascular disorders. They inhibit the activity of this enzyme and thus
Okay, okay,
prevent the
thank you.
cardiovascular disorders. Thank you, sir.
Okay, thank you. You can.
Okay, thank you so much, Sarita. It was a nice presentation. Now, next candidate, we have Tamanna with us, and she's going to speak on a review on contamination in soft drinks. Mental contamination in soft drinks and its impact on human health.
Good afternoon, everyone. It's an honor to address such an indistinguished audience. I'm Tamanna. Today, I'm here to present a review on the metal contamination in soft drinks and its impact in human health. What are soft drinks? Soft drinks are the class of non-alcoholic beverages, usually but not necessarily carbonated, normally containing a natural or artificial sweetening agent, edible acids, natural or artificial flavors, and sometimes juices. Soft drinks are usually beverages used in our day-to-day life. Soft drinks are also called ready-to-drink beverages. Now, what components are present in the soft drinks? It composes water, carbon dioxide, artificial sweeteners, preservatives, sugar, acid, artificial colors. Now, this is the first research paper by Godwill et al. He determined the soft drink constituents and contamination by some heavy metals in Nigeria. In Nigeria, soft drink is one of the most consumed beverages. The consumption of non-alcoholic beverages in Nigeria was rated at 159.85 grams per person per day. This study evaluated some constituent of 26 soft drinks in Nigeria and investigated the presence of some heavy metal contaminants using atomic absorption spectrophotometer. The presence of some heavy metals such as cadmium, lead, mercury, arsenic, zinc, etc. in soft drinks, which may be due to environmental pollution from surface and underground water, food, and fruits utilized during production, have been reported. Heavy metals are the metals that have shown to be harmful and toxic to human body. Now, he did the test for the carbon dioxide. In the sample, lime water was added and the change of the lime water from colorless to milky confirmed the presence of dissolved carbon dioxide in soft drinks. Carbon dioxide can change the pH of the water. Carbonated drinks are made by injecting carbon dioxide into the water under pressure. The more carbon dioxide injected, the lower the pH. The more acidic it gets, the more frizzy it is. Now the test for the presence of sugar. Bendic solution was added for the presence of the sugar. The formation of the reddish color confirmed the presence of sugar in soft drinks. Test for the reducing sugar was done using Fallon solution. The appearance of the brown precipitation confirmed the presence of reducing sugar. Now, what are the effects of consuming sugar? The consumption of just 1 or 2 serving of sugar sweetened soft drinks daily significantly increase the risk of metabolic syndrome and a type of diabetes and increase the risk of coronary heart disease. The daily intake of sugar should be less than 10 teaspoons per day for a 2000 calories diet. While soft drink mainly composed of sugar, when we take too much soft drinks, it causes obesity. Now the test for the presence of the phosphate was done by adding ammonium molybdate followed by the concentrated nitric acid in the sample. The appearance of the canary yellow precipitate confirmed the presence of phosphate ion in soft drinks. Phosphorus is one of the most abundant mineral in the body and is vital to bone and tooth health and energy production. Phosphorus added to the carbonated drinks, usually colas, in the form of phosphoric acid, it gives a tangy taste in the mouth and tingle when swallowed. Previous research has suggested that the phosphorus released from the phosphoric acid in soft drink causes calcium to be lost from the body, causing the risk of brittle bones. Now test for the alcohol. Alcohol was determined by adding iodine in the solution followed by potassium iodide and sodium hydroxide in the solution. Appearance of the yellow colored precipitation confirmed the presence of alcohol in soft drinks. Now this study showed the presence of the concentration of heavy metals like iron, zinc, lead, copper, cobalt and cadmium in them. The soft drinks were acidic in nature. The acid concentration was relatively between 3 and 12 grams per liter. Lead was present in all the samples ranging from 0.17 to 3.39 milligram per liter. Mercury was present in 22 samples ranging from 0.29 to 11.39 milligram per liter. Cadmium was present only in one sample. When compared to EPA, WHO, and NIS standard, the level of heavy metal contaminants were above the tolerated limits in most samples. In another paper titled Analysis of Sugar and Heavy Metal Contents in Beverages Consumed in Nigeria, Yugeo et al. In 2020 analyzed the sugar and heavy metal contents in beverages. The method in this paper include the screening of the data set from Nigeria with the sample size of 10. The quantitative analysis of sugar content and heavy metal content was determined using UV spectrophotometer. The concentration of lead and cadmium was found to be higher than the safer limits set by WHO and USPA. In another paper titled Determination of Trace and Heavy Metals in Fruit Juices in Romanian Market, Bora et al. In 2020 reported the metal analysis in fruit drinks using ICP-MS method. This study recorded the highest concentration of copper in multi-fruit mango and kiwi juices, and another heavy metals which were detected were lead, cadmium, and arsenic. Aldarji et al. In 2020-21 investigated the kidney function and liver function on consuming soft drinks. The method in this paper include the webbing of data set of blood samples from Iraq with the sample size of 120. A clear negative relation was detected, which shows an ill effect on the liver and kidneys on consumption of soft drinks regularly. Now, what are the impacts of these metals on our body? Copper. Copper is an essential constituent of many metalloproteins and enzymes involved in electron transfer, oxygenation, and oxidation processes. Hence, the deficiency of copper causes deactivation of these processes, leading to anemia and loss of hair pigments. This led to the accumulation of copper in liver, kidney, and brain. Thus, the central nervous system is damaged. Accumulation of copper in liver may lead to death. This physical abnormality is called Wilson disease. Chromium. It is involved in the metabolism of glucose in the mammals. Chromium and insulin both maintain the correct level of glucose in the blood. Cadmium is extremely toxic metals and it can causes flu-like symptoms, cadmium blues. Calcium. The level of calcium in the body is usually controlled by vitamin D and parathyroid hormones. Nickel is essential trace element. Its deficiency in food slows down the functioning of livers and is highly toxic to plants and animals. It is carcinogenic if present in higher concentration in our biological system. Lead has no non-biological function. It is highly toxic to plants and humans. These results suggested that soft drinks are contaminated with heavy metals, which constitute a major public health problem. Thus, quality control is recommended during production process, especially at the stages of sterilization. Now, the possible sources of contamination can be the raw material, processing, packaging, in transportation, preparation, and other stages. Health-related issues which are caused by consuming a lot of soft drinks are diabetes, coronary heart disease, cardiovascular disease, obesity, tooth decay, high blood pressure, memory loss, and kidney failure. According to studies, the consuming of the sugar consumption dulls the brain mechanism for knowing when to stop eating. Soft drinks are among the most significant dietary sources of tooth decay. In 2012, Harvard studies found that one daily 12-ounce serving of regular soda was linked to a 19% increase in the relative risk of the cardiovascular disease. The high level of phosphorus acid in these soft drinks have been linked to the kidney stones and other kidney related problems. Tooth decay. All soft drinks are acidic, which erodes the teeth by eroding its enamel. Soft drinks are also increase the risk of developing hypertension, obesity, and raise the risk of kidney related disease. Soft drink may also increase the risk of osteoporosis, especially in the people who drink soft drink instead of calcium rich milk. At last, I want to say we should not sugarcoat the health risk of sugary drinks. Thank you.
I have one question from you. Can you give examples of artificial sweeteners?
So, ethylene can be used.
Okay, one more question. You have reviewed only this the contamination of all these soft drinks, or you have performed some experiments also. Only review was
Oh, no,
presented?
review. Yes, sir.
Can you tell me the principle of AAS, atomic absorption spectroscopy?
Yes, sir. Sir, in AAS, we use a light source or basically in a sample, we use a sample in a gaseous form. And if we have a liquid or solid form, we have to convert in gaseous using flames or another source like lamp vagera, so that the electron atom converted into ions, and that when we pass a source of light uh, from them, that these electrons get transformed from the ground state to the higher level of state, and in transferring from the ground state to higher state, they absorb some amount of energy, which is detected by using AS spectroscopy. Thank you.
What are your findings here?
Sir, presence of heavy metals in the soft drinks.
You have not identified also.
Sir, I have just reviewed the papers. Thank you, sir.
Thank you so much, Tamanna. Well explained and such a wonderful paper. All right, now we have another participant. Next delegate is Mr. Kulvinder Singh, and he's going to present through offline mode. His topic is physiochemical analysis of municipal water in various districts of Haryana. Kulvinder?
Fine. Good afternoon, all of you. I am here to present my paper. Title is Physiochemical Analysis of Municipal Water in Various Districts of Haryana. First of all, I am discussing about introduction background. Water is one of renewable resources necessary for all form of life, food production, economic development, and for general well existence. The security of drinking water is influenced by different chemical and microbiological contaminants. These contaminants causes some genuine well-being issues. Due to these contaminants, the quality of drinking water is breaking down day by day, which causes numerous diseases within the people. The residential, sewerage, and industrial squanders are the driving causes of groundwater contaminations. Among these, the overwhelming of matter like zinc, arsenic, copper, cadmium, and lead. They are much more poison than that of other matter. So, drinking water must be free from these type of harmful substances and impurities. Nowadays, uh, this is one of major challenges to provide a green and pure water within the industrialization and globalization. And that's why the purpose of our study is to find the and to check the quality of water and find the impurities in the water. And finally, we have to collect the water sample from 8 districts of Haryana with proper and necessary equation during the period March 2022 to June 2022. So the areas and locations of so this is locations and districts from state of Haryana, which mentioned here location code and districts. Here is Rohtak, Bhiwani, Bahadurgarh, Hisar, Karnal, Jind, and Kaithal, Sirsa. And now I'm discussing about the materials and methods. All the samples were analyzed by using physiochemical parameter, and all the chemicals are used having air grade and prepare solutions by using double distilled water. Here is, we have to use the parameter is pH meter, is using digital pH meter, electrical conductivity by digital conductivity meter, total alkalinity by using titration method, total hardness by using complexometric titration with EDTA, and chlorine ion with UV visible spectrophotometry. And finally, I'm discussing about result and discussion. Here we have to find the final result from the physiochemical parameter. We have to discuss also. This obtained result will be compared with a standard permissible limit given by the standard bureau, like that Bureau of Indian Standard, Indian Council of Medical Research, and World Health Organization. This standard permissible limit recommended by the BIS 1999, 1975, and 2006, which is given standard limit by the standard drinking water quality. So first of all, first parameter, I'm discussing about the pH meter in different districts of Haryana, which having, we have to conclude that in district of Bahadurgarh, which having note will be permitted limit predict by the BIS, ICMR, and WHO. And next parameter we have to discussing about electrical conductivity. Maximum conductivity is 1300 Siemens meters was observed in district Jind and minimum at district Kaisar. But the value which recommended by the unit is 1400 Siemens centimeter, which recommended by the WHO to 2006. And next parameter, I'm discussing about the total alkalinity, which is ranging from 236 to uh, which 236 to somewhere is 236 to 736 approximate. The maximum value have been recorded in district Karnal and minimum at district Bahadurgarh. So the which occur also variation the total alkalinity within the permissible limit predicted by the BIS, ICMR, and WHO. And we have to discussing about the total hardness. The minimum value which found at district Kaithal and maximum at district Hisar. So it's also some permissible variations occur in BIS, ICMR, and WHO. I'm discussing about chlorine. Minimum value was observed as the sample Bhiwani, Jind, and Kaithal, and maximum is observed in district Bahadurgarh within the permissible limit predicted by the BIS, ICMR, and WHO. So finally, I'm discussing about the conclusion. The results show significant variation in water quality parameter for different locations. And there is municipal water of different districts is suitable for all drinking and domestic purpose. But in some areas, there is need to treat to minimize the contamination, especially alkalinity. However, in this the hazardous effect of fertilizer, pesticide, animal waste, and sediment will not be detected in the municipal water. So it advised that the waste product should not be deposited near the water sources. And finally, if when we secure the nature, we protect the nature. Definitely, nature protect us. Thank you.
Have you done your own this study or just a review?
This is my own study.
It's your own study. So why did you choose only these 8 districts and not other?
Yeah.
Why did you choose only these districts as a sample size? Why not other districts?
Sir, sorry, I'm not getting your question.
आपने इन्हीं जो
Oh,
है
sorry.
regions की
This,
study को
yeah,
choose किया?
this is my first step proceeding work. Further, I'm calculating like that fluorine, magnesium, calcium, and this is my proceeding work. So later.
Okay, so what is study concludes about which district water is going to be fit for in our aspect? What do you conclude?
Sorry, sir, I'm not getting that.
आपने जो स्टडी किया है तो इन 8 डिस्ट्रिक्ट में से किस डिस्ट्रिक्ट का पानी आप बेहतर बताएंगे आपकी स्टडी के बेसिस पे?
हमारी स्टडी में कंक्लूजन स्लाइड वापस हो गया सर। कुछ डिस्ट्रिक्ट में जैसे मैंने अब वो स्लाइड वापस रिपीट करनी पड़ेगी। कुछ डिस्ट्रिक्ट में मैंने बताया कि जैसे हमारी कुछ डिस्ट्रिक्ट में जो वेरिएशन आ रहा है, जैसे मैंने जो डिस्ट्रिक्ट मेंशन किए थे उनमें मैंने पर्टिकुलर बताया था कि इन डिस्ट्रिक्ट में वेरिएशन आ रहा है, और जो मैंने डिस्ट्रिक्ट मेंशन नहीं किए दैट मीन्स वो उसी रेंज के अंदर आ रहे हैं। जिनमें कुछ वेरिएशन था वो मैंने मेंशन कर दिया।
मतलब ये है कि जो ओवरऑल आप क्या कंक्लूड कर रहे हो, किस डिस्ट्रिक्ट का वाटर जो है वो ड्रिंकिंग पर्पस से बेस्ट है? बढ़िया है।
ओके सर,
ओवरऑल सब कुछ मिला के
आपने 8 दिए, रोहतक, सिरसा, भिवानी।
हाँ सर, वो अभी आई एम चेक हियर।
सबसे बेटर पानी कहाँ का है पीने लायक? और वैसे भी आपने एक स्लाइड में बताया कि क्लोराइड कंटेंट बहुत ज्यादा है, तो अगर क्लोराइड कंटेंट ज्यादा है तो उसके हेल्थ हैजर्ड्स क्या है?
डेफिनेटली
आप उस डिस्ट्रिक्ट को यहाँ कैसे जस्टिफाई करते हैं?
इसके कुछ हेल्थ इफेक्ट होते हैं, जैसे कि अगर क्लोराइड हमारी बॉडी में ज्यादा होता है, इसमें कुछ होते हैं हमारे जैसे वोमिटिंग like that, other effect also, sorry. Thank you.
Thank you so much, Kulvinder. Now, next participant, we have B. Sabitha, and she's going to present through online mode. And her topic is spectroscopic thermal properties and applications of some heat-resistant polymers. Sabitha, are you connected with us?
Yes, ma'am.
Okay. You can proceed with your presentation.
May I audible, ma'am?
Yes, yes, you are.
Thank you, ma'am. Good afternoon to everyone. May I audible, ma'am?
Yes, you are audible.
Ma'am, the screen is visible.
Yes, the screen is also visible. You can proceed. Yes.
Thank you, ma'am. Good afternoon to one and all. So myself, Sabita, research scholar of OSGU. My guide is Professor Dean Renu Sharma, ma'am. So today I give presentation on a topic that is spectroscopic thermal properties and applications of some heat resistant polymers. 1 minute, ma'am. So here, this is the introduction. The heat resistant polymers are employed in high temperature, high altitude applications. The heat resistant polymers include polytetrafluoroethylene, polycarbonate, polyethyl terephthalate, polyimide, etc. It is generally believed that the polymers containing aromatic groups have good thermal stability when comparing with the aliphatic polymers. Though the various types of polymers available, there is a need to develop a new system with a high thermal profile. In this context, we are discussing about the 5 investigated on thermal degradation mechanism of curved phenolic resin by using the NMR spectroscopy. And the Kondaya et al. Have reported on synthesis, characterization, and biological activity, behavior of some novel resistophenone shift base ligand and their metal complexes. Noack et al. Have reported on resin based on 2,4-dihydroxyestophenone and characterized them by IR spectroscopy. Solution properties, fungicidal properties of the resins are investigated. Shashikala has developed high heat resistant aromatic polymers like 3-amino 4-hydroxybenzoic acid and 4-amino benzoic acid with superior thermal stability of 740 degrees centigrade from inedible biomass and feedstock without inorganic filters. The Kuroda et al. Have studied degradation of aromatic polymers like polycarbonate, polyacrylate, polyesteramide, polysulfone, polyether sulfone. These polymers were degraded in vacuum at 380 degrees centigrade and molecular weights distributions are measured by gel permeable chromatography. The polymers preferably undergoes cross-linking rather than degradation. The degradation of cross-linking in order of like this order only. The carbonate linkages isopropylidene moieties increase the rate of chain session. They have also reported on degradation of polyimide to thermal and thermose oxidative degradation. And they studied the changes using the gas permeable chromatography, IR techniques, and the cross-linking of polymers is observed by the recombination of free radicals produced by cleavage of diphenyl methane linkage. The cross-linking is reported to be affected by moiety of molecular chain. When glass transition temperature reaches the degradation temperature, thermo-oxidative degradation proceeds in a different manner where cross-linking continue after glass transition. The relation between the cross-linking density and glass transition temperature and degradation behavior is also observed. Sandro Dattalo et al. Have studied thermal degradation of polyether sulfone with random copolymers using mass spectroscopy, gas chromatography, and TGA methods. The thermal degradation is reported to occur at 370 to 650 degrees centigrade with a char residue of 32 to 35%. The thermal degradation data suggests that decarboxylation of pendant acid moieties during initial stages of degradation. Session of isobutyl groups is reported in the temperature range of 420 to 480 degrees centigrade involving main chain session of diphenyl sulfone and diphenyl ether groups. The Kober JR has probed that the degradation kinetic of aromatic ether polymers. Jiang have investigated on thermal stable novel ester based polymers using XOD, DSC, and biphenyls techniques. The polymer is reported have good water barrier properties than the polyethyl terephthalate, polyether 2,6 naphthalate, and polyamide fins. Chaufurete reported on superior thermal stability and forced crystallization behavior of novel biodegradable alpha methylated bacterial polyester. In the present studies, they attempt to study two new molecular systems. These are DHPPE-FM and DHPPE-FM PMAP by the spectroscopic, that is by IR and NMR, and thermal methods, that is TGA and DGA methods, DTA methods.
Could you hear
So
me,
here
Sabita?
I told that, yes,
Sabita,
ma'am.
am I audible to you? Yes, very sorry to interrupt, but participants are requested to wind up their papers within 7 to 8 minutes. Okay?
Okay,
So
ma'am. Sure. This is the
let's wind up.
experiment.
Okay, so
Okay, ma'am.
conclude your paper, please. Okay?
Okay, ma'am. So this is the experimental
Within
method.
1 minute, okay?
Okay,
Within
ma'am.
1 minute,
So
conclude your paper. Okay.
okay, ma'am. So this is the monomer, that is 2,4-dihydroxyphenyl 2-phenyl ethanol. So it is synthesized. By using this adding of another monomers, I can prepare two copolymer resins. Those are 2,4-dihydroxyphenyl 2-phenyl ethanol formaldehyde and 1-2,4-dihydroxyphenyl 2-phenyl ethanol formaldehyde paramethoxyacetophenol. It is called as 2,4-DHPPE PMAP. So these are prepared. So these are some of the monomers which are used to prepare the resin copolymer. So this is the reaction. So in this resin, reaction, 1 minute. So here in this reaction, first we can take this three monomers under catalyst and under heating. I can prepare this resin copolymer. So this is the resultant discussion by the NMR spectrum.
Sabita,
Yes, ma'am.
please conclude your paper. We do not
Okay,
have
this is the NMR data and of the
Just
both
come to the
compounds.
conclusion.
Okay, ma'am. Okay, ma'am. This is the IR data. 1 minute, ma'am. So the conclusion is that the heat resistant resin copolymers of 2,4-DHPPFM and 2,4-DHPPPMAP are characterized by the NMR and IR spectroscopic methods and explain the thermal stability and this thermal stability by the TGA and DSC methods. Thank you,
Thank
ma'am.
you so much. Any questions, sir?
Am I audible to you?
Yes, ma'am.
Can you
Yes, sir.
mention some of the pharmaceutical applications of the polymers you have studied?
Sir.
Am I audible?
Antimicrobial activities, sir.
Antimicrobial. Any reported work on this?
In my thesis, I have studied some topics on that, sir.
Okay, okay. Thank you.
Thank you, sir. Thank you very much to one and all.
All right, thank you so much. Now, another participant we have is Mr. Rakesh Kumar, and his topic is in vitro evaluation of antimicrobial property of copper, nanoparticles, and chlorhexidine against Streptococcus aureus. Rakesh, he's going to present through offline mode.
ठीक है.
Good morning, sir. I am Rakesh Kumar, PhD scholar in USCU, and my topic is in vitro evaluation of antimicrobial property of copper nanoparticle and chlorohexidine against Streptococcus aureus. Next is introduction. Streptococcus aureus is gram-positive pathogenic bacteria spread on community acquired and hospital acquired. The treatment remains challenging due to emergence of multi-drug resistant strain such as MRSA, methicillin resistant Streptococcus aureus. Yes, ureas enter in internal tissue and bloodstream. These bacteria may cause a variety of potential serious infections, and chlorohexidine have antimicrobial properties are attributed to its dicationic structure and chlorohexidine remain the gold standard for which other anti-plague and gingivitis agents are compared. Its effectiveness can be attributed to its bactericidal and bacteriostatic effect that is substantively within the oral cavity. By understanding the biochemical properties of chlorohexidine and appreciation for the efficiency and use of chlorohexidine can be developed to treatment of skin infections. And nanoparticles are increasingly used for targeting bacteria as alternative to antibiotics. It utilization of nanoparticle in antibacterial coating for implantable device and medicinal material to prevent infection and promote wound healing in antibiotic delivery system to treat disease, in bacterial detection system to generate microbial diagnostic and antibacterial vaccine to control bacterial infections. Nanoparticle next are increasingly used for target and next इससे next करो हाँ एक पैक करो एक मिनट ठीक है we add 2 mm of copper nanoparticle powder in 8 mm of normal saline sanitation, and similarly we prepare a stock solution for commercially valuable 2% chlorohexidine gluconate solution, and we added 0.2 ml of chlorohexidine in 9.8 ml of sterile distilled water to achieve a concentration of 100 milligram in 1 ml, and the resulting solution was kept under magnetic steering at 500 rpm for 18 hours or overnight, and centrifuge at 10,000 rpm at 4 degrees Celsius for 40 minutes, and the supertank was collected and evaluated by UV spectrometer for the unbound chlorohexidine molecule. The chlorohexidine in a nanoparticle form, and we separate rinse 2 times within in double distillation, and next next is result. Chlorohexidine nanoparticle are analyzed for size and zeta stability potential measurement by dynamic light scatter, and the optimized nanoparticle size was found have 120.8 nanometer. Chlorohexidine nanoparticle have a zeta potential is minus 45.3 millivolt and represent in figure 1. Next figure होगा इसे next हाँ this is figure 1 and next back back. The rate demonstrate the discharge of chlorohexidine from nanoparticle polymetric matrix, shield it from speedy metabolism and degradation. In vitro drug release significance 78.29% of chlorohexidine was released within 3 hours, but a stain release was observed in chlorohexidine nanoparticle with 38.22% and 74.48% chlorohexidine release after 3 hours and 24 hours respectively, and that means 38.22% in 3 hours and 74.48% in 24 hours. The release profile in chlorohexidine nanoparticle demonstrate a sustained release to chlorohexidine and the passage of their hydrophobic hydrophobic that with non-polar nature of chlorohexidine. The encapsulated efficiency depend upon the nature of method and employed and the extent polarity of the molecule nature of the encapsulating material and media for the synthesis of nanoparticles. The percentage of encapsulation efficiency was effectively for chlorohexidine nanoparticles. Next. And the size, shape, and dimension of nanoparticle affect release, drug releasing rate, solubility rate, and dissolution rate of a molecule per drug. And the chlorohexidine nanoparticle was found to be segregated spherical, having particle size 28 to 55 nanometer. And the FTF spectroscopy was used to confirm the loaded of chlorohexidine in chlorohexidine nanoparticles, and FTR spectrum of chlorohexidine so absorption band at 3112 centimeter, or OH represent the molecule hydrogen bond and 2632 centimeter and 2001 per centimeter showing stretching band for the terminal of methyl group and group 1. Next one is antimicrobial potential of BCNP had the evaluated on Streptococcus aureus. Chlorohexidine nanoparticle have a efficiency potency to effectively kill a compared to chlorohexidine as a control. Surface area of these nanoparticle very high, and that potential relates the antibacterial activities. Next. And main conclusion, nanoparticle is nanoparticle of chlorohexidine, a new efficiency technique to combat various disorder, and various nano formulation are marketed these days to combat cancer type, and that arise the free radical efficiency. And we investigate both qualitative and quantitatively in vitro release rate and in vitro antioxidant potential and anti-cancer section of polymeric nano formulation of chlorohexidine nanoparticle. This novel polymeric nanocarrier of chlorohexidine nanoparticle might serve as promising future of the fight against bacteria and hold a lot of potence power of the preclinical and preclinical trials for futures. Next. This is references and next is thank you. And this one also reference and thank you. Have any questions?
Why did you choose only chlorhexidine is very well reported one? So what's the novelty of the work?
Novelty chlorhexidine having lot of antibacterial property for many microorganisms and main not lot of work on this topic is not concluded so much, and this is
Is also copper contributing towards antimicrobial
a
activity or not?
copper particle that contain the high surface area and more, एंड डेट मीन कि जो कॉपर है उसमें पार्टिकल थोड़ा सा एरिया ज़्यादा होगा, सेकंड मेटल की डेंसिटी ज़्यादा होगी, इस वजह से वो प्रेसिपिटेट हो जाएगा नीचे. मेनली हम इसको जो यूज कर रहे हैं कि बैक्टीरिया की एज नॉन लिविंग चीज़ों को हम उसको स्टेरलाइज करने के लिए हम यूज कर रहे हैं. अगर हम लिविंग की बात करें कि मान लो ऑर्गन की हम बात नहीं कर रहे हैं, नॉन लिविंग ऑर्गन की बात कर रहे हैं, जैसे कि ये हमारा ऑडिटोरियम है, इसको हमें सैनिटाइज करना है, डेट विल बी यूज ऑफ कॉपर पार्टिकल इम्बेडेड क्लोरोहेक्सिडिन डेट फॉर लॉन्ग टर्म रिलीज. इसमें वो लिखा भी हुआ था लाइक 24 आवर में इतना रिलीज होगा. सर MRSA टेक्निक डेट जो बैक्टीरिया है उनके पास वो जो स्टेन है लाइक ग्राम पॉजिटिव बैक्टीरिया डेट कंटेन मल्टीपल स्टेन. नॉर्मल अगर हम बात करें कि ग्राम पॉजिटिव
कैसे अप्लाई किया है?
सर इसमें अप्लाई का मतलब क्या था कि इसमें हमने टेस्ट किया कि ये यानी कि फार्मा में जाके इसमें ये देखा कि कितनी स्टेन पे काम कर पा रहा है.
किससे देखा?
सर वो थोड़ा सा चेक किया था रिजल्ट में, फार्मा वालों से थोड़ी सी हेल्प ली थी सर.
इट्स फ्रॉम फार्मेसी.
यस सर, फार्मा के स्टूडेंट्स से किया.
हमारे से कैन नॉट बी चेक इन फार्मेसी.
इतना मुझे आइडिया नहीं है.
इट इज बाय कल्चर इन द लैब, माइक्रोबायोलॉजी लैब.
Yes, ma'am.
You have to check MRSA from there. If you found resistant, means it is microbial activity.
Yes, ma'am.
It is hampered.
तो फार्मा वालों से थोड़ी हेल्प ली थी इसी के लिए, MRSA करने के लिए.
Last question, apart from S always, it can show activity against any other organism also?
So, अभी सिर्फ इतने में ही किए, बाकियों में इतना नहीं किया.
Okay, thank you.
Okay, thank you.
Okay, thank you so much, Rakesh. Next, we have Miss Rita Kundu, and she's going to present through offline mode. Her topic of presentation is phytoconstituents and pharmacological profile of Prosopis cinerea.
Thank you, ma'am. Good afternoon, all. Myself, Dr. Suman Sutha, and today my topic is Phytoconstituents and pharmacological profile of Prosopis cinerea L. a review. First of all, these are the outcomes, introduction, method and materials, result, discussion, conclusion and references. Introduction. Ever since first civilization, plants have been valuable source of fuel, food, shelter, timber, herbal, medical, and food for the people and the animals. The plant are natural laboratories and unique chemists which synthesize numerous compounds belonging to various categories such as terpenoids, alkaloids, glycoside, phenolic, and tannins, having diverse molecular structure and uses. Plants' foods such as vegetables, fruits play a vital role in human health, being providing carbohydrates, fats, vitamins, proteins, and minerals. Next, Prosopis cinerea. L. durac is endemic to hot desert of India, commonly known as khejri and jandi plant. It plays a vital role in preserving the ecosystem of arid and semi-arid region. The importance of khejri is increased due to socio-economic development of the India, especially Thar Desert in Rajasthan. Because of these have the high nutritional value, so mostly in Rajasthan region, the Thar Desert is mostly used khejri plant for as a feed for camels, goat, and other animals, and so people use their pots for food. Khejri is the tree of medium size with stand in temperature up to 48 celsius, so it is also known as king of desert. Is also known to be kalptru because of its all part are very useful in the form of food, feed and medicinal value. Khejri plant are the region in Rajasthan Bisnoi community which can play a vital role in the conservation of wildlife. A great woman lady, Amrita Devi from Visnoi community sacrificed her life in 1731 to protect the Khejri tree in Khejriala village near Jodhpur. This tree is worshipped by the various group of peoples, was used as a theme for the stamp to be released on the occasion of World Environment Day on 5th June 1988. Next. The Prosopis cinerea aldurec commonly belongs to the family Leguminosae and subfamily Mimosidae. Is a small, thorny, irregular branch tree, 5 to 10 meter in height, evergreen years, so it form a open crown and thick, rough gray bark with deep features. Flower of this plant have wide spectrum of biological activity. The flower of this plant is found mixed with sugar and used during the pregnancy as a safeguard against miscarriage. Next, pods of Prosopis cinerea are good source of vitamin A, C, iron, protein, and other micronutrients. Dried and boiled sangri is used as a vegetable in human diet and most common constituents of popular dishes, tricuta and panchkuta. It is the one of the most delicious and famous dishes of Rajasthani cuisine. Unripe pods of khejri plants and fruits have high nutritional value and are mostly used in the preparation of various diseases. Sangri pods are mostly known to be their preservation of protein and mineral deficiency. Dried pods are locally known to be kokha. Next. The bark of Prosopis cinerea is powdered and mixed with flour during the scarcity of food and famine. It is a very useful as a folk treatment in the earliest system of medicine for different ailments like asthma, leprosy, leukodema, tumors, dysentery, bronchitis, and piles. These plants exhibit several biological activity like anti-cancer, bactericidal, fungicidal, antiviral, antihelminthic. Jandi is said to be potent drug used as a tonic, blood purify, and for the treatment of skin diseases. Next, the extract of leaf of Prosopis cinerea is used for the treatment of boils and blisters, including mouth ulcer in livestock. For hair removal therapy, it, treatment of rubbing of bark ashes of khejri is the most popular amide. For the cure of dyspepsia, fresh leaf juice of jandi mixed with lemon juice is a famous therapy, and crushed pod are the most useful to kick and pain relief from feature bones. fractured bones. Sorry. Leaf of Prosopis cinerea have highly nutritional value as well as medicinal, commonly known as long. The smoke of leaves is beneficial for the cure of eye problems. Jandi is a major feed constituent of the desert livestock, which provide nutritious and better survey product from the dry fodder and eaten by camels, sheep, and goat. Next. These are the methods and materials. Plant materials of Prosopis cinerea are collected, shadow dried, and chopped into small pieces. Chemical constituents were extracted in methanol by refluxing. Extract was concentrated on a hot water bath under reduced pressure. The viscous mass so obtained was mixed with silica gel 60 to 120 mass size, dried and then subjected to column chromatography by using solvent of increasing polarity. Evaluation of the phytoconstituents and pharmacological activity of promising methanol extract and fractions will be done. Preliminary phytoconstituent screening. The methanolic extract was taken for various quantitative chemical tests to determine the presence of various phytoconstituents like alkaloid, glycosides, carbohydrates, phenolics, tannin, and phytosterol, fixed oil, protein, and amino acid, flavonoids, spunins. Mostly used by these tests are used to be detected by reported method. Next. These are the flow chart of experimental process. Yes, ma'am. Next. Phytoconstituents present in plant: saponins, carbohydrates, flavonoids, alkaloids, and terpenoids and phytosterols are present in flower. Next. In bark, saponin, carbohydrates, alkaloids, terpenoids, phytosterols, these are also present in bark. Next. In leaves, saponins, carbohydrates, flavonoids, alkaloids, glycosides, phytosterols, and fats and fixed oil. All these are phytoconstituents present in leaves. Next. Saponins, carbohydrates, flavonoid, alkaloid, glycosides, terpenoids are present in pores part of this plant. Next. At last, conclusion: the Prosopis cinerea, which is mainly known as khejri, it is most important for their nutritional value and pharmacological action, can be contributed a lot of world health as a herbal plant. Various part of this plant can like leaves, bark, twins, flower, fruits, spores, usually treatment of various therapeutic effect. The Prosopis cinerea have various biological activity. It is used as a fodder and for the eating purpose. It was thought to be interest to investigate this plant for its biological constituents and to determine the binding capacity of phenolics with protein. The effects of phenolic compound present in food are widely studied among the protein phenol interaction. These phenolic compounds play a vital role in the preservation against a wide range of disease, including cardiovascular disease, certain type of cancer, osteo. These can also help. They are also harmful for us. However, these protein phenol interaction of various phytochemical constituents help to control the functional aspect of food productions, period of processing, transportation, and storage. Next. Thank you.
Which one is the main phytoconstituent that's in this plant?
Flavonoids, terpenoids, and alkaloids.
Any reported name here?
Stigmasterol, beta cytosterol. These are the steroids.
And what could be the possible nutraceutical value of these particular plants? You told me it has some nutritional value.
Yeah.
So what could be that? It is rich in what type of nutrients?
There are various type of nutrients. Nitrogen also present. Iron, calcium, magnesium. All these are present in all parts of these. Welcome.
Thank you so much, ma'am. All right, next we have a e-poster presentation by Ms. Anjali, and she's going to present on an assessment on physical and chemical parameters of Sidmukh feeder canal water, Hisar.
Thank you, ma'am. Good afternoon, everyone. Good afternoon, everyone. Today I'm here to present my poster on assessment of physico-chemical parameters of water samples of Sidmukh feeder canal. Sidmukh feeder canal is the branch of Bakhda Nangal. It has derived from Bakhda Nangal Association. As we all know that water plays a very important role in human life, the consequence of urbanization and industrialization leads to spoil the water. Over large parts of the world, humans have inadequate access to potable water and use sources contaminated with disease vectors, pathogens, or unacceptable value of toxins. The poster for this study is the objective for this study is the study includes the collection of various drinking water samples from different sites. Different sites from canal are selected and samples are analyzed for physico-chemical parameters. The samples were collected from almost 70 different areas and analyzed by various technical analytical techniques. Methodology, there are various methods which we have used here for the different parameters: electrical conductivity, alkalinity, dissolved oxygen, chlorides, phosphates, sulfates, fluorides, cadmium, and lead. Fluoride, sulfate, these are analyzed using UV visible spectrophotometer. Chloride by agenotometric method, and lead and cadmium toxic by atomic absorption spectroscopy. These are the observations, and we have also plotted the graph regarding the observations. The conclusion for this study was that the different parameters that we have selected, like as total hardness, chlorides, pH levels, alkalinity, and electrical conductivity, and fluorides, phosphates, were reported within the permissible limit. According to permissible limit, according to BIS and WHO standards, lead and phosphate concentrations were not found in any of the sampling sites. The study concludes that water supplied is safe for drinking purpose and for agriculture purpose. So thank you so much.
Did you perform an experiment on these?
Yes, sir, I have performed.
Did you perform agentometry titrations also?
Sir, basically I have taken help from GJU and HAU, and I have taken the help from these universities.
Is it possible no lead content was found and
Yes, sir. In these findings, it was possible. No heavy metal was detected.
what are the instruments used for the heavy metal detection?
Like atomic absorption spectrometer. Sir, I have used this one only. Thank you, sir.
All right, it's time to wind up the morning session. And we are pleased to have the presenters to present such wonderful papers over here. And after a keynote from the University of Bingham, Nigeria, we will begin with the evening session. The session will be begun just within 10 to 15 minutes.